We do the suctioning and the cleaning care for the inner cannula. Okay, the number one, we have to just prepare the equipment for suctioning. This is the chalk, this is the stethoscope, this is the key you needed. Everything is inside, including the steady glove, and this is the normal setting, expiration date, and the name of the solution. This is the suctioning machine. You have it this one. If you have it that one in the wall, you have it that one, you can only connect the two. These two, just connect over there and then just connect the catheter in the other side. They allow you to touch the oxygen. This is now the patient have it 2 liters per hour. You can increase to 5 or to 10, but don't forget when you finish, just put it back into 2 liters, okay? Then after that, you still identify the patient, explain the process to the patient. Then after you explain, you have to do chest assessment. How you do chest assessment? You have to get the stethoscope, it's clean already. Just coming to do the apex for the lungs, 1 minute, 30 seconds to 1 minute, 30 seconds to 1 minute. The other side, compare the second intercostal space, compare second intercostal space, 3 to 4 intercostal space, 30 seconds to 1 minute, 30 seconds to 1 minute, and then 5 to 6 intercostal space, mid axillary line, and then compare the other sides. The patient is suction. Then we have to prepare the patient. And the institution where you work, they allow to just use a PPE. You can use a PPE and the mask will share. Protect yourself, protect the patient, okay? Then we have to prepare the equipment. You see this one, the plastic one, remember, don't put your fingers inside, just leave it inside, open. Then the solution, after you check the name and the expiration date and how long was open, then you can use it. Then repeat a little bit and just put in the container. This one is work because you need to check the catheter before you start using it. At this point, turn on the machine, remember? And bring the tube and close to the patient. Be careful with the patient's face, okay? Then you have to wear the gloves. Gloves open. Remember the packages like that, just get the first one. Don't touch nothing, just wear the first one. Then with the gloves on, you have to put in a size. Make sure that it's in the square of this inside. Then we go to put the second one. Remember, you can put the skin to skin, finger to fingers. That's good, okay? Okay. Something happened with the fingers. When you have it here, you can fix it. Now, you see the catheter is inside. You take this, protect the tip. That's the most important thing. You see the right hand, 3 fingers, just cover the tip. These 2 fingers, just hold the tube like this. Okay, you can, they say you can wrap it this between your hands, you can do it, but I know just protect the tip, that's the most important thing. Then, this is my contaminated hand. I put it here, then I check if my catheter is working, checking the solution. My catheter is working, okay? Then I go with the patient, then you see the pinky, the left pinky, you put it here, just go inside. Try to not touch nothing outside. When you find the resistance, you see the thumb is up. When you go back, you just come in, suction. Into number 6, you see the 6 is better, you take it because it's short to the tip. When it's longer like that one, when you remove, just place the secretion of the patient's face or maybe in your clothes. That's why there has to be less is better for the thing. Then put it back the mask and flush the catheter. Flush. Okay. Then go back. Pinky, go inside, and then go inside first. You see my thumb is up, and then I go back. Back till to number 6. They don't have number, just calculation, okay? To calculate that tip, flush. How many times you do? As needed. There's no having numbers. Don't put the 1, 2, 3. No, don't put the numbers. It's just the patient need, you have to do back and forth. Okay. Sometimes you see when you do suction, the catheter is clean. The catheter is clean, this means the patient don't have any secretion. Flush, put the tip in here, put it back the tube, put off the machine, and then you start to cover the catheter with gloves. Why? Because it have a body fluid, remember? Okay, then everything go to the garbage. When you finish to do, remove a little bit down and do reassess the chest to the patient, because you need to know this clear, the chest is clear. This the apex for the lungs. Compare second intercostal space, second intercostal space. Compare 3 to 4, 3 to 4, 5 to 6, 5 to 6. My patient is clear. Just in case it's not clear, you have to put it back everything, wear the steady gloves, and then do it again, because you have to make sure the chest is clear. Okay, this is one part for suctioning only. Okay.